One thing I want to go over is the importance of reading your own MRI in our field. So if you're in interventional spine and you order a lot of MRIs, cervical, lumbar, thoracic, it is very, very important for your patients to bring you the CD and you go over the MRI with your patient. So we have a nice setup here. We have a big screen and I can go over all of the imaging with the patients. Do I look at their report? I do look at their report just to make sure there's nothing crazy there that I'm missing. You don't want to miss a kidney cancer or something along those lines. But I mainly go off of what I see because we've looked at so many MRIs. So this is just an example of a patient that you can go over with them right in the office and kind of scroll through the sagittal here. This patient has an L4-5 spondylolisthesis. If you just say that to the patient, they don't really understand it, but this puts some visual to what's going on. So I'm just going to show you guys how I go over an MRI with a patient. I tell them this is the back, this is your belly, we're looking at you from the side. This is the top, this is the bottom. You have your spinal cord coming down the middle here. You have the white around it, which is the spinal fluid that protects the spinal cord. Then at L1, L2 areas where your spinal cord ends, and then the spinal nerves continue down. Then we have the anterior column, which has the vertebral bodies and the disc. So we have vertebral body, disc, vertebral body, disc, vertebral body, disc all the way down. We look for the abnormality then. So I go to the patient, up here, this all looks good. These discs look nice and hydrate. But then when we come down here, we see this little slip where it goes forward. The L4-5 moves forward over the L4 vertebrae moves forward over the L5 vertebrae, and we show them that that's where their problem is likely coming from. Then I'll go over to the axial component of the MRI here and show them, I tell people this is like a Google Earth view or looking down from the head down. And we'll scroll down, and the most important part of this MRI is the spinal cord in the middle with the fluid around it. We're looking to see if that becomes compressed at all or if there's any issues there. So as we go down, we see this purple line, and it's tracking down the spinal cord. And as we go down, we can see it's nice and open, nice and open. We get here a little bit of compression, and then it opens back up nicely, nicely. And then when we get to the point of concern, we see that the spinal cord has really compressed down. There's a lot of stenosis there. And the patients really enjoy when you go over the imaging. It's better for you to really look at the images. You know exactly what you're going to do when you're doing your procedure. You know what you're up against when you're doing your procedure. For this patient, I did transforaminal epidural injections at L4-5, so I could really get around that stenosis. If I try to do an interlaminar injection here, I wouldn't be able to get in. There's not much epidural space there. There's not room there, and I know that because I looked at the images. This patient did really well from the epidural injections. They could also benefit from something that would fix the listhesis, like a Minuteman procedure or an open fusion if needed. But right now they're doing really well from the transforaminals. But it's very important to take this time, which has only been a few minutes, to go over the imaging with the patient. The patient will trust you that you know what you're talking about. You'll trust yourself that you're doing the right procedure. And it's great for the whole patient-physician relationship.